Okay, so what are patient-reported outcome measures? So first of all, as I already mentioned, there are measurement tools, questionnaires, surveys, to harness information on patients' health about their own perspective on their outcomes, on their health status. Okay, so they're called outcomes, but actually we're not asking the patient, what is your outcome? Because it's hard for patients to quantitatively say their outcome. So we usually measure these in 2 points in time, and we ask patients about an aspect of the health status. So usually a baseline, and before, and one after. And then we're measuring a degree of change. It depends, this is condition and context dependent. So sometimes, your before and after is much more lengthy and gradual, so you might do repeated measures for long-term, for example, long-term diseases. I'll go on to events like sudden emergencies, what I am personally interested in researching, when you can't get a before event because they don't know they're going to have a stroke tomorrow, they don't know they're going to have a heart attack tomorrow. How do you capture real time before their baseline and afterwards? But in theory, essentially, you'd collect it in 2 points in time, 2 time points, and you measure the change. So you can mark them against patient progress or health interventions received. There's also lots of dedicated research, just to mention, and including colleagues here at Kyoto University on validating questionnaire types, concerted efforts by lots of dedicated research groups on developing questionnaires. Essentially, there are 2 types of questionnaires available, broadly termed as generic and condition-specific. Okay. So generic PROMs are, for example, the EQ5D, which many of us have heard of, perhaps used or seen. 5 dimensions, fairly easy, straightforward to fill in for patients. Lots of, and also SF36, again, very widely used, both. And they essentially allow comparisons between conditions. And they're called generic because they ask the aspects of a general health status. For example, they can be compared, they can compare across different conditions. And so fairly helpful for economic analysis because you can derive utility measures such as QALYs, etc. from it. In England, on the National PROMs program, it uses the EQ5D. Some of us use that quite often as well. And then there's also condition-specific PROMs, which are usually used alongside the generic PROMs because they have greater sensitivity and specificity to the conditions being used, to the relevant clinical details. The generic PROMs, one of the limitations and sometimes criticisms is that usually it's not sensitive enough or there's a ceiling effect, etc. But for condition-specific PROMs, much more helpful for the clinician because it's focused on measuring a particular aspect of health and much easier to understand the clinical management. And a common one and on the PROMs program uses, for example, is the Oxford Hip Score for hip arthroplasty, Oxford Hip Knee Score. And you might have used some of your own in your own research in specific disease areas. Okay, so what is our current state of our health services? These might be familiar to you. Care not is sufficiently patient-centered, perhaps. There's a lot of administrative and regulatory complexity, or continued dominance of acute hospitals. Just to name a few, variable productivity. Some are doing a lot, some are doing very little. Poor quality care, and dispirited staff. So, the health system is under a lot of pressure. Maybe many of us are familiar with aspects of it. So why do we want to measure PROMs? It's been advocated that PROMs may be useful, powerful tools for changing the health services. Looking at different aspects of it from a different way shifts the balance of power towards patients, as mentioned. It may be a disruptive technology, and we might know that it's new, and disruptive technology means that it might change certain status quo of the system. So that's been popular to do. At least in many countries are starting to increase the focus on it. And essentially, there are three ways that it may help and it can help.